Jason, Dr. Capitosta here. I really don't find too much in here. This is the lateral meniscus, or outer side of your knee. This is the posterior horn of the lateral meniscus. I'm going to clean that little distal stuff up, but that's not really a tear. And I've been all over this meniscus, top and bottom, and there is no tear there. Now we're coming around. This is the middle 1/3 of the meniscus. This is the anterior 1/3 right here. And all of that looks pretty darn good. This is your articular cartilage of the top of your tibia, the lateral tibial plateau. See how bouncy it is? That's good. That's normal. That's a young man's knee. There's no arthritis in there. When I lift this up, you'll see a tendon going obliquely from about the 4 o'clock position to the 10 o'clock position. That right there is called the popliteus tendon, and that's intact, so that's normal. That's your lateral compartment. Here's your lateral femoral condyle, and that all looks good. Now we're going to come into the intercondylar notch. This is where your cruciate ligaments are, the anterior and posterior. The anterior is intact. The only thing, it looks like it may have been sprained right there, but that does not have to be repaired. Only when the tendon is torn completely across like that do you repair it. So this is nothing. That's nothing that has to be worried about, nothing that has to be repaired. But you can see it attaches here at the anterior portion of the anteromedial portion of the tibial plateau, and it goes up and attaches in the medial face of the lateral femoral condyle, right up in there. So this is just synovium. This thing here is synovium. That's the lining of the knee joint, and there's no blood or anything to indicate that that's torn. There's the femoral attachment of the anterior cruciate ligament. Now over here, you can't see this, but I can feel it. This is the posterior cruciate ligament that I'm pushing in back here. I try to expose it, but I can't because it's wrapped in synovium. But that is intact, and it goes from the posterior part of the tibia up to the lateral face of the medial femoral condyle right in there. Okay, now this is the medial femoral condyle, and that all looks normal. This is the anterior horn of the medial meniscus right there, and that's not torn. This is the mid-third of the medial meniscus, and that looks normal. Let's lift that up, and we can go under there, and if the probe doesn't catch, if there were a tear in there, the probe would catch. So it doesn't. So now I'm going to look at the posterior horn. Give me a little valgus. Okay, this is the posterior horn right in here. And I'm going over the top, and see what I'm doing is I'm going over the top like this, then I turn my probe like that. And if there's a tear, it'll catch. But it does not. It slides right off. So there's no tear on the top. Now we're going underneath and doing the same thing, and it doesn't catch. It doesn't catch anywhere, so there's no tear there. Now we're going to go in the medial gutter. There's no loose bodies in there. This is on the inner side of your knee. That looks pretty normal. Okay. Now we're going to go over the top, straighten the leg out. I'm going to show you the patella, and I think this may be causing some of the problem. Because you did have, when I first entered your knee joint, you had some, can we stop that? Okay, good. You had some loose bodies floating around, little pieces of crud that had come off somewhere, and I think they came off from the patella. It's just a bubble, actually. See, that's just a bubble. And I think the problem is right here. I think this stuff is catching under your kneecap and causing some snapping. So we're going to shade that away. This is what we call the trochlear groove, or the femoral groove. Your patella tracks right in this area like a needle of an old record player. It tracks right in there, and that's pretty normal. We'll go all the way down to the intercondylar notch. See it there? That's normal. This is the infrapatellar fat pad. That's normal. And we're going to go up here into the suprapatellar pouch. Here's my drainage needle right there. See it? That's the drainage needle. That'll come out. Now we're going to go look in the lateral. This is the outer side of your knee. This is called the lateral gutter. And again, that is totally normal. There's no loose bodies or anything in there. And it'll come around. You'll start seeing the lateral femoral condyle again right there. And the lateral meniscus right there. Alright? This is the lateral face of the lateral femoral condyle. This is the periphery of the lateral meniscus. See it? And we can open that up and again and show you the joint. Slight figure 4. Put it in slight figure 4. There. See, there's your lateral compartment again. So we've been all over the knee, and the only abnormality I find is a minor abnormality under the patella. So we're going to shave that, and let me show you how we do that. You have the the back one.
Thank you.
Okay, this is my rotor rooter, and see it's got that thing in there, and we're just going to shave some of that away, and we're going to shave some of this away. Okay. That's on oscillate. I have a suction in there, and it's chopping the stuff and sucking it away at the same time. So sort of in your face right there. I think at the beginning of the procedure I talked about a complex tear of the meniscus. I was wrong. There was no tear of the meniscus, and basically what it is a little bit of patellofemoral arthritis right there, and we're taking care of that right now. I'm shaving that. Okay, and you know that's not going to go away, but hopefully it'll be better than it was before. Right there. That's the undersurface of your kneecap or your patella that I'm shaving right now. Trying to smoothen that out. Okay. And Jason, that's the only thing that I found abnormal in your knee, so I guess that's good and bad. If this works and you're pain-free, then it was a good thing we did it. If not, no harm, no foul, you know. Okay, I'll talk to you in the office.